Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a primary care, weight management, and aesthetic medicine practice located in Great Neck, New York.
Good afternoon, and I'm Irina Berger. I'm a co-founder of Northeast Medical Practice, and I'm also administrative director. Dr. Berger, there are multiple studies done in terms of correlation between weight loss and diabetes. Would you be kind enough to elaborate and talk a little bit about those new studies?
Of course, so I'll talk very briefly about two trials. One is called the DIRECT trial. In this study, they tracked the patients for 2 years. And what they did was they created a pretty intensive lifestyle change program utilizing monthly follow-up, a nutrition specialist, a nurse, as well as meal replacement products to help the patient lose weight. And what they found is that by the 1 year mark, 46% of these patients who had diabetes when they started the program had remission of their diabetes. And at the 2 year mark, 36% of the patients still did. So of course it can be a little tough to keep everybody on the tough vigorous regimen throughout the whole 2 year period. But 46% by 1 year, 36% at the 2 year mark. So over 1/3 of the patients had remission of their diabetes just by utilizing lifestyle and meal replacement products. So the likelihood of diabetes remission was also correlated to how much weight loss and when it happened. So a good amount of weight loss, like 10% in the first month or two, was highly correlated with an increased likelihood of remission of diabetes. So basically hitting it hard early on, getting good weight loss, and then some more, and maintaining that over a long period of time was able to keep these patients in remission. So there was another study done in the UK as well. This was a 5 year study, but similar sort of protocol and similar sort of results. At the 5 year mark, they showed 30% of their patients had remission of their diabetes. So I want to say, from the perspective of our practice, we do pretty similar things here. We have intensive follow-up in our weight management program at least once a month. You're performing health coaching, I'm doing nutrition counseling, and we also utilize meal replacement products, the Robard system that we use here in the office for bars, shakes, soups, and other kinds of foods to help control caloric intake. So bottom line, with vigorous lifestyle intervention, it's possible to have a significant impact on diabetes and even reverse it for about 1/3 of patients, as per these two studies.
It's interesting because throughout coaching, patients always say, "Oh, I'm genetically predisposed," right? And my parents had diabetes, my grandparents had diabetes, and this is clearly shows that yeah, maybe you have predisposition, right? But it's really in your power to take charge and reverse the diabetes. And also, we see significant example with our patients. Like, one patient comes into mind. He recently lost about 20-25 pounds, and he was able to work out. He came with a very severe diabetes, and I believe you placed him on Manjaro, and he was working out twice a week. Twice a day, and he also took 1,000 calories per day. So he basically was eating only once a day, and I believe he also went with keto diet.
Yes, that particular patient did. I actually had to start him on a blood pressure medicine in the beginning too, but I've been able to take him off the blood pressure medicine and decrease his dose of Mounjaro down to the very lowest one. Hopefully we'll be able to get him off it entirely. But so that also illustrates the power of vigorous lifestyle intervention that we do here in our office.
And it's funny because I was asking him, what if you don't work out, throughout the day? He said, I'm already programmed. If I don't work out at certain hour, I still do it later in the day. It's like I'm brushing my teeth, and this is what I'm doing every single day. I'm working out. This is the power of changing your habits.
Exactly, and that's what we reinforce here for all of our patients in the weight management program, whether or not we utilize medicine. the strong lifestyle program needs to be in place. So I'm sure you found this informative. Please reach out to us. We're Northeast Medical Practice, 516-604-3418, or through the web at northeastmedicalpractice.com. We look forward to seeing you in the office. Bear in mind that all of the things that we share in our videos are for educational purposes only. We have not yet established a doctor-patient relationship, but we look forward to hearing from you soon.
Thank you.